And before we dive in, I want to acknowledge our funding partners that help make this work possible. Our signature partners, the John A. Hartford Foundation, EMD Serrano, and our care leaders, Satsuka Novardis, Eli Lilly, and our care supporters. We couldn't do this work without you, without building a vibrant funder community that shares the same vision that we do. Thank you. And I want you, and two things I want to point out as part of our strategy, turn data into action. You'll see outside there's a data gallery. We encourage you to engage with that data gallery, to engage more with Caregiving in the US, a signature partnership between the National Alliance for Caregiving and AARP. We also have a wall. This is National Family Caregivers Month. We are thrilled to be able to celebrate with all of you and kick off National Family Caregivers Month. We have a gratitude wall too, that we encourage you to leave a note for the person who you named today in that wall. So thank you so much. And as we welcome our first panel to the stage, the state of caregiving in the US, please turn your attention to the screens. This is the first of many stories that you're here today about the men and women who make up our caregiver nation. Thank you.
We've loved dancing ever since we were together. First night that we started dating. And so when the sunrise came in, we would dance right there on the floor. It wasn't a pretty sight some mornings, but he held me up.
We were told that, your attitude is a big piece of your healing. We feel we have a very strong bond between the two of us, and at that moment, that's all we needed. And we were gonna make the most of every day, whether tomorrow ever came or not.
We both had our careers. We both were, passionate about those careers.
We're just busy doing our thing, happily living life, raising a family.
I honestly never felt ill. Rick did find a lump, went in and had a mammogram right away. I actually found out while I was caring for people with dementia. I was in a nursing home. My doctor called and he had the biopsy results. He just said, Suzanne, I need you to know that this is not good. You do not want to look this up. The diagnosis was a very grim prognosis because of the aggressiveness of the cancer, stage 4. We're going to put you into a protocoled treatment in order to give you whatever time we can get you. It's overwhelming. It's almost paralyzing.
Your mind races. It really does. It goes all over the map from what does this look like? How long do we have?
Rick came in and he said, I know you're deciding and I will do whatever you want to do. I will love until the end. And so we went the next morning, went into surgery instantly, and we were in chemo in 4 days from that moment.
Well, her fear of the whole process, the changing of a woman's body, was very fearful for her in many ways. And I saw that and I heard that in her voice. And I just said, I want what's left. I will love what's left. The depth in which it's going to take you to, caring for someone, you just do it. You just dig right in. It doesn't matter what needs to be done. Get up every day, you're going to take care of this person. It's a commitment that is going to scare you, but when you're doing something for that person, it's so rewarding. I wanted to be the one doing it, not someone else.
Well, we laughed at my baldness.
We went to the salon as a family, and she shaved her head.
And they jammed music.
Everybody was proud of Mom rocking the bald. So my job was to keep the attitude up and positive and bring light on as many situations as I could, which, some days was hard. An important thing as a caregiver was having a community surrounding. I think that comes back to my circle of guy friends that were there for me every step of the way. I could be vulnerable with those guys, and that allowed me to let out all the emotions that I bottle up.
Marriage is about these times, the times that he had to do personal cares that were uncomfortable for him and uncomfortable for me, but I knew that I trusted him, and that trust and connection was what got us through.
Of course, work ended for Suzanne, and I cut my work way back, so it had a pretty big financial hit.
That's something that nobody really talks about, but as two self-employed people, we we found ourselves both not working for a time. It was just very eye-opening to us all of a sudden to realize that there were people always advocating and fighting for voices to be heard, and the National Alliance for Caregiving was one of them. They are there every day making sure that our stories are being told. Life for me is not looking at the monkey on my back. They have reminded me that I still have cancer and that this is not the kind that goes away, but it's a choice every morning to say, I'm not gonna allow it to take over my perspective and my life and my attitude. I'm going to just believe today. Your commitment to me made a difference. Sacrifice made a difference.
Your willingness to fight for us, for your family. You went through an awful experience, and you did it amazingly well. Made hard decisions, but you did it for the love of your family. And I just want to appreciate that.
Welcome to the stage, our state of caregiving in the U.S. panel. Moderating today's discussion is Madeline Mitchell, Women and Caregiving Economy Reporting Fellow with USA Today.
Hello, everybody. Good morning. Welcome to the National Alliance for Caregiving Caregiver Nation Summit. I'm so happy to be here today. My name is Maddie Mitchell. I'm a reporter for USA Today. I've been covering women in the caregiving economy since March. This is a new position with USA Today. It's a grant-funded fellowship position. I'm really grateful to Pivotal Melinda Gates Foundation for making this possible. I'm really grateful to be able to tell these stories. I think a lot of us are here today for the same reason. We know that we're in a caregiving crisis here in America. And back in July, there was a report that came out, Caregiving in the US 2025, and it really drilled down into what this crisis looks like on a national scale. We saw that since 2015, we've grown 45% in the number of caregivers in our nation. And so we'll drill down a little deeper into some of that data during this discussion. But I want to just open this up by saying that this panel is going to talk about this data and also talk about the real people that represent this data, like Suzanne and like Rick. So one more round of applause for them and their being here, telling their story. We're also going to talk about solutions and what we're going to be looking for moving forward as a nation as we talk about caregiving. So to get us started, I'm going to start with Regina. If you want to introduce yourself, tell us a little bit about your work and your professional and personal relationship to caregiving.
Great. Thank you so much, Madeline. It's so wonderful to be here with you all and with our fellow panelists. Thank you for having me. I am trained as an epidemiologist and I work at the Emory-Rollins School of Public Health, and I'm also a policy researcher at RAND. So I seek to do research that has policy implications. And I focus on the causes and consequences of mental disorders and dementia. And for a long time, I really wanted to find the cure for Alzheimer's disease and related dementias, and did a lot of different kinds of research. But I realized that there were millions of Americans who lived with dementia. So what do we do after there's a diagnosis and we haven't prevented dementia? And so about half of my research now focuses on family caregivers to people with dementia, as well as access to home and community-based services to help people with dementia age in place. Little did I know that dementia would hit so close to home, with my father-in-law being diagnosed with Parkinson's disease and also my grandfather being diagnosed with Parkinson's disease. So I look forward to talking about that experience as well as my experience as a youth caregiver. Thanks.
Thanks, Regina. Rick, do you want to introduce yourself to the room?
Thank you for having us here. It's a privilege to be here and representing the caregivers of the world. I'm just one small voice in this large situation that's going on, and very proud to have been a caregiver to my wonderful wife. You know, we've had raised a wonderful family, and this, drops in your lap. And as I said on the video, you do what's necessary. And I didn't have any experience in caregiving, growing up in rural Wisconsin, raising our family, self-employed. So, we didn't know what was out there. And my goal is to hopefully find support and information and advocacy for caregivers going forward. So whatever I can do to help, I'm glad to be here.
Thanks, sir. Suzanne?
I should have wore a disguise. We are so grateful to be here. The opportunity that Pfizer and NAC provided was just incredible, to come into our lives and ask our story and tape for 6.5 hours. So there's a lot of tape that's on the floor somewhere. But it was a privilege to share that story. I myself am a care recipient. My sister is currently battling late stage on ovarian cancer. So three sisters all had cancer at 48, 49, and 50. And two of us had very, very aggressive late stage. And so I'm a part of her caregiving team. And part of her caregiving story has unfolded because of my story, because of the lack of supports that we experienced. So as a professional, I'm a nurse, and I've been a caregiver advocate for dementia, people experiencing neurodiversities, and also people experiencing trauma, and listening for the voice that is not being shared, and creating solutions for that. So that's what I've done for 25 years, and now do as a consultant. But I'm really grateful to be here, and sorry for all the tears ahead of time.
Thanks, Suzanne. Rita, do you want to introduce yourself?
Sure. Good morning, everyone. So good to see everyone. And I wanted to start by acknowledging this wonderful partnership that AARP and the National Alliance for Caregiving has with the release of caregiving in the U.S. It is just always such an honor to be able to do this work with NAC. I'm Rita Shula. I'm the Senior Director of Caregiving at the AARP Public Policy Institute. And honestly, my work is so intertwined with my personal journey. The two are really inseparable. Honestly, my personal journey is really the catalyst and the evidence that gets me to do my work every day. And I think it's really important and really critical that we remember these lived experiences that we all have and that we bring to this work. I focus very much in the space of bridging policy and research to practice. I think far too often they're siloed, and caregivers need us to come whole. They need us to understand that they are holistic beings, that we are all holistic beings, and that solutions can't be siloed. And so I'm very fortunate to do that work with an amazing team of experts within the Public Policy Institute, and working with so many of you all here.
Thanks, Rita. I'm going to stick with you, Rita, here for my first question. We spoke back in July when the report first came out. And as we know, there are 63 million Americans who are caregivers right now. But you made a really good point when we started talking about this. You said family caregiving impacts more than just individual caregivers. It really impacts whole families. So what can you tell us about what the scale of the 63 million number, what does that really mean for American life today?
I was really glad that you brought that question up. I think it's so important that as many caregivers are isolated, there are many individuals that are truly doing this on their own, but there are so many that are in families, and the sheer toll of the caregiving responsibilities that go with that role truly impact everyone in that household. 3 areas that I wanted to focus on. One, and you'll hear from the remarkable Dr. Phelan Lewis shortly, but is around youth caregivers. My children, I was a sandwich generation caregiver. My children were actually born into their caregiving situation, I guess. As I cared for my mother with frontotemporal dementia, For 8 years, I was caring for 2 children. And thinking about the youth caregivers that are in that household and the things that are being expected of them that so often go unrecognized. I think that's one really critical piece. I think the second piece is the financial impacts that happen. It doesn't just happen to one person, it happens to a family. If I'm not able to save, that has impacts on my retirement, but it also has impacts on what I'm able to do with my children. Am I going to be able to put as much to their college education that I might have been if I wasn't balancing elder care and child care to the tune of thousands of dollars a month at any given moment? I think another piece that we don't talk enough about is the impact on marital status and partnership. My husband asked me to marry him knowing what was getting ready to come. And almost 20 years later, we're still together. And so often we don't think about what those familial impacts are going to be. We just have this expectation that caregivers are going to do what they're going to do. It's their responsibility. And we need to do better as we analyze and think about that.
Thanks. Thank you, Rita. Rita and Regina, I'm wondering if both of you can kind of take us through anything that surprised you in this data, or what did you learn? Because I think a lot of this was kind of confirming what we already knew about caregiving, but what parts of this report did you not anticipate finding?
Sure, I'll go first. So my sister was diagnosed with lupus when she was 12. And a couple of years later, she received a kidney transplant, and she actually received a kidney from my father. And so I really was a secondary caregiver until we had 2 family members who were recovering from surgery. And during the period before her kidney transplant, she was on home dialysis, peritoneal dialysis, which, as you know, occurs overnight. So it is almost like around the clock care. And my mom did a lot of that care. I don't know how she would have done it had she not been a nurse. And what really surprised me in the report was that 55% of caregivers say that they engage in nursing and medical tasks. And it really made me feel less alone to know that. And 22% of those people say they received training and supports, which is just abysmal. If my mom didn't have high literacy, I don't know how she would have been able to keep my sister in our home. And then the other statistic that was staggering was, I think 96 or over 90% of people said when they did receive those supports, they felt better prepared to engage in those medical and nursing tasks. So that's a clear win. If even we don't know what that training was, that those caregivers felt that it was helpful in them, in preparing them for those medical and nursing tasks.
And I think for me, there's not much that surprises me, unfortunately, anymore. But what I will say that sits with me a lot, and Jason alluded to this in his opening comments, is the juxtaposition between the 51% of caregivers that say they find purpose and the realities of what they are juggling and dealing with in that purpose. And I think that it's really critical that we don't substitute purpose for support. And I think it's very easy for professionals, whether you're a healthcare professional, an employer, a financial professional, to take for granted that the individual at the bedside or the individual in the home, oh, they're going to do this. It's their mother, it's their partner, it's their friend. And so we can lock on anything to them and they're going to do it. I mean, when we hear that part of that purpose and fulfillment is feeling useful and necessary, we also know that nearly half report financial losses in doing that. When we hear that it provides personal growth, develops resilience, we know that 1 in 5 family caregivers from this report talk about their own health is fair or poor. And so we are consistently saying to caregivers, do more, do more, do more. And we take advantage of this 51% without really thinking of ways to better support them so that they can feel purpose and do it not having a loss financially, to their own health, whether that's mental and physical.
Thank you. So we've talked a lot about some of these statistics, talking about financial impacts, health impacts, mental health impacts. Rick, I want to put it over to you to tell us a little bit about what the daily life is like of a caregiver when you're caring for Suzanne. What does your daily routine look like? What kind of tasks do you need to perform? And how does it impact your life outside of caregiving?
Well, it's certainly a life change. It's thrown in your lap, and you get up every morning, making sure that she would be able to do what she needed to do for the day, whether it be medications or get to appointments or just daily cares. Because at some point she just didn't feel like getting out of bed. So you're motivating, you're making food, you're just kind of doing the daily things that happened in a household, and so without any medical training in my past, we really didn't know what was out there for help. I didn't seek help. I just took care of what needed to be done every day, and so it had a large financial impact on us with her not being able to work, and then my being self-employed, I went half-time so that I could be there to take care of Suzanne as much as I could. We had friends and family that helped as well, which was a very big blessing. But the knowledge of what to do was kind of scary when you just haven't been a caregiver like that before in your past. And so being here and talking to everyone and hearing all the statistics, I certainly agree that information is power, and how to get that information out to people that are caregivers are going to become a caregiver someday. We all are. It's pretty obvious with the numbers. So and I didn't know that there was places I should be looking for financial help or caretaking help. I just did it. You get up every morning and do the same thing, and some days I'd go to work, some days I wouldn't. So there's a need for information. I'm not sure how to get that to all these people that could use it.
And in Wisconsin, where Rick and Suzanne live, 55% of family caregivers also work. And so again, this is state by state data that is now available through AARP and the National Alliance for Caregiving. You can kind of go through and see state by state what that looks like. And Suzanne, another statistic I wanted to kind of share with everybody, and through your own experience being a long distance caregiver to your sister. So we found that more than 10% of family caregivers live an hour or more away from the person that they're caring for. Can you talk a little bit about what those unique challenges are, living even states away from the person that you're trying to care for?
Absolutely. So one of the things that my siblings and I decided to do once Jennifer was diagnosed and this summer was that we would share the care so that her husband could go to work and her kids could go to school. Because if we wouldn't have done that, then somebody was staying home from college. Her daughter was willing to stay home from college, but we didn't want to interrupt that life for her. So 3 of us siblings, we each go and we spend 3 weeks at a time getting her through a very, very difficult treatment, and including hospitalizations in between, and just very, very difficult complications that have arose from it. So we all fly across the country. My sister goes from Montana to Vermont and back. My brother goes from Wisconsin to Vermont and back, and I go from Wisconsin to Vermont and back. But we do this so that they can go to work and so that they don't have the financial hardship that we experienced because we didn't have anybody that could go to work for him or take care of me. So the other piece that I'll share is that because I'm a nurse, I was chosen to be the one that cared for my 2 parents, and that was 2.5 hours away. So and they both had very complex cares, which of course my brothers who lived local did not know how to do. There was no training involved. And so I went to work, and then I traveled 2.5 hours after work to go care for my parents and get them set up to go to bed. And then I would come home because I refused to not be with my family. And I did that for 6 months to 8 months. And it's a very difficult thing. It's mentally wearing. At sometimes I felt like I was going to go off the road because I was driving home at 11 o'clock every night of the week. And what I knew was that when I saw that care experience of my parents and that care experience of my recent caring for my mother-in-law, was that when you have a navigator at the point of care, helping you discern and make informed decisions, you utilize medical services much less. You have many fewer unnecessary hospitalizations, and you have less premature institutionalization of that care recipient. So I have had the gamut of experiences. Rick and I are currently caregivers for our granddaughter who has complex medical needs and special needs. So and we care for her so her parents can go to work, and which cuts out our retirement because we're close to retirement. And but it's amazing the distance creates an added burden as well as added costs. And it tends to be that if you become a caregiver in one facet, you're the one that they look to in the next one. So.
So you've all shared your personal connections to caregiving, and I'm wondering how these relationships have changed. So you might start as a spouse or a sibling or a parent-child relationship and then enter caregiver. How does that change the relationship? And then what advice do you have for people who are trying to keep some semblance of normalcy through the caregiving journey? We can just go right down the line.
Sure. So I'll share about my sister. She was a teenager when she was dealing with all of the symptoms associated with lupus. And I think as someone living with a chronic condition, they don't want to always be asked, how are you feeling? And when you are on dialysis and the solution isn't perfect during the overnight dialysis, you can feel really nauseous. So we had to strike this balance of always wanting to ask, how are you feeling today? But also trying to keep her sense of normalcy in how she was going to school in high school. But, there were really difficult situations at school with kids not understanding her illness. So that changed our relationship as sisters. And then with my parents, I saw a lot of strain on their marriage. They're still married today, but they had to go through, parenting is hard, period. And then you have a child who, if their port gets infected, lands in the hospital. With the kidney transplant, we had to go through a lot of care decisions together. My parents are very capable, but they don't speak English as their first language. And I remember the first doctor who saw my sister in the hospital thought that she had a cold and wanted to give her antibiotics and send her home. And that doctor came back to apologize. And my mom couldn't find the words to express her anger and disappointment. So she just said, "You're fired." It was wonderful to see. But, she didn't speak English as her first language. So I participated in a lot of the care decisions. And I participated in the care decision when she was in the pediatric ICU, and we had to take her off life support 1 year after her kidney transplant to the day. So on her 1 year anniversary, she passed away. So there was a lot that changed. But in terms of normalcy, we try to keep things as normal as possible. I know all of you have tried to do things as a family when there's a caregiving situation and try not to make it about the person's disability or chronic condition. And so, she was immunocompromised for a long time. We couldn't go out to public spaces, watch movies together. So we would set up a projector, which are now pretty pervasive, but we got a projector and made it a home movie night, or we got the big bags of dialysis solutions delivered to our hotel room. We went to Disney World, so they would, stack them up 5 feet tall and line the hotel room. So we tried to make things as normal as possible.
Becoming a caregiver for Suzanne probably brought us closer. It brought our whole family in and around us closer that helped us out, from our children, good friends, your siblings, and we're always there supporting us if they could in person, but reaching out to us mentally to, hey, how are you doing? Is there anything I can do to help? As far as that didn't change anything as far as our relationship. like I said, I think we got closer, but what we decided to do was, as you talked about, moving forward, um, when we got to that point of knowing that this is what tomorrow brings and this is what the next day brings, we decided to take this on as this is the new normal. This is what we're going to tackle today. It's just another challenge. And we take it head on and just make the best of it, make the best of every day, and enjoy every moment that we were going to be given to spend together. And like she said, caring for our special needs grandchild gives you a whole new perspective of how you can spend as much time you can with them and help their family move forward every day to be closer, and the mental strain that you go through as a caregiver. Someone, you need to reach out to someone. As I said in the video, I had a circle of 3 to 5 guys that we were very close with, and I reached out to them often. They reached out to me and allowed me to deal with my emotions, and where I wasn't going to show those emotions to Suzanne because I wanted to be her strength to get her through her daily treatments or daily pain. And so it was important for me to have a group of people to help me.
I'm going to start by saying I'm the luckiest woman in the world. I carry the badge, I hold it, and I protect that badge because I've been very blessed. And I know, understanding the diversity of our world and our society, that not everybody has that experience, that has that husband that will do those cares that are not necessarily fun, right? And still love you through it. And so when you ask about normalcy, we had a very unique marriage to start. We were both very positive people, but the number one thing we did for our normalcy is to protect our hope and our positivity. And it's interesting to say that we literally had to protect it from the healthcare team, who kept reminding me that I had no chance. And I am 7 years post. So I would like to go back to all of them and say, remember my expiration date you gave me? I passed it. But so our normalcy was protecting each other's hope and protecting each other's positivity. And this may seem very, very, I hate to say this, but one of Rick's jobs was to protect me from people shaming me. The shame that you get for being a care recipient. Did you find out what you did to get cancer? You wouldn't believe how many people asked me that question. When we talked about our finances, and I shared with a social worker that I was distraught mentally and emotionally, that I was leaving my husband absolutely in ruins financially, because nobody's emergency fund goes 2 years deep when you're self-employed, or 6 months with no work, self-employed. I mean, we had one, but it didn't go that deep. But when that social worker, when we said, is there anything that can help us? And she said, well, are you going to choose differently next time? The shame was incredible. So he protected me after that from people's shame, from people's, aren't you doing this? Aren't you going to Mexico? Aren't you going? And that continued our normalcy then, to be able to maintain our hope, maintain our positivity, despite everything that was going on around us, and how people were willing to share those comments that they wanted to share. So that keeping the normalcy of our child that was still living at home. My son was in PT school and he wanted to quit PT school. Not happening, buddy. You worked really hard to get there. My daughter was in high school. Maintaining her mental health was a huge priority. And I feel for you, because the children that are going through the caregiving my kids missed out on a lot, because their mama ran for 8 months every night and missed every basketball game and every football game or whatever was going on in their lives, because I was taking care of my parents 2.5 hours away after work every day. So.
I'll continue on that normalcy pattern. I think the biggest thing for me was creating a sense of dignity for my mom as she experienced FTD. it's a disease that takes away so much so quickly. And so it was really important for me to make sure that she was cared for, which meant a lot of battles with a lot of people. But it also meant I had 2 young children. So it also meant making sure that they understood grandma and that they weren't scared of grandma and that they understood that unfortunately this was a part of life. And so as she did have to go into, we did have to place her in a nursing home. We visited her several times a week. And while my children did learn their first curse words from their grandmother, because of her behaviors that, you know, she had from FTD, they also knew that there was a drawer of snacks for her. So that a 3-year-old or 4-year-old saw the normalcy of having a grandparent. And so she's deceased now. She passed away in 2020. But they were able to now look back and say, my grandma, right? And they didn't see her as someone with dementia. They saw her as their grandmother. And that took a toll on me. That took a toll on my marriage. But at the end of the day, when we look back at it, it also drew us closer. And it made me understand what it really meant to sacrifice. But it also made me understand that I had to ask for help. And that's something that I'm not good at, hadn't been good at, but realized that I wasn't going to survive if I didn't. And so in doing that, as my husband says, the wall finally broke and you let me in to help you. And I think that's something very important. So it's really that dignity for the person you're caring for, that normalcy for any children in your life to help them just know that, you know, they count, that they matter. And then at the end of the day, making sure that you as that caregiver get the help you need to take care of yourself.
Thank you, all of you, for sharing those tips. And thank you, Rita, for bringing this up, because I did want to point out that the report found 27% of caregivers are caring for someone with Alzheimer's or dementia. And so kicking it back to you, Regina, I know that this is your focus in your work. Can you talk about the unique challenges for someone caring for someone with dementia and maybe some of the best solutions you've seen, some good supports for people that are caring for someone with dementia?
Yeah, I'll start, but I know I can't cover everything. So, I think both my father-in-law and grandfather having Parkinson's disease, it's been said it's like the long goodbye, and there's just this progressive nature that results in very, very long caregiving. And so this, I think it was a very large proportion who said that they cared for people for 5 years or longer in the report. And so that was true for us. And things are breathtakingly fast for some dementia symptoms like agitation and personality changes. And other things are not linear, like the freezing and the slowness of walking and the tremors. And so I think it's really important to remember that people who are caring for those with dementia have, compared to caring for other conditions, a lot of physical and mental and psychosocial impacts, much more than others. And this is why dementia is the most costly condition in America, even though cancer and heart disease still kill more people in America. It's because of caregiving costing 80% more than for other conditions like cancer, cardiovascular disease, and end-of-life costs are 65% more for dementia than they are for other conditions like heart disease and cancer. So there are a lot of really great supports for family caregivers, a lot of multi-component interventions like driving independence, taking away the keys while also giving them the dignity and the autonomy to make that transition, dealing with sundowning and wandering. There are a lot of great programs to help family caregivers. But if I had my wish, I would say these Medicaid cuts are drastic and will hurt so many Americans who rely on this source of support. We were talking about Medicaid buying for the middle class that's not eligible for Medicaid, and we're now talking about cuts. This is ridiculous. So fund Medicaid supports for people with dementia and their family caregivers to be able to compensate them appropriately, and Older Americans Act funded services for family caregiver supports. Older Americans Act reauthorization and full funding. We are working with the Administration for Community Living, and when I say we, it's a big partnership between National Alliance for Caregiving, Emory, University of Wisconsin-Madison, University of Pittsburgh, and Marquette University and U.S. Aging, and we're all trying to help these Older Americans Act funded family caregiver supports for people with dementia to stay in their community. So it's really important that we continue this work And we couldn't do it without all of the supports of our partners, but we really have to give those family caregivers education about what is out there for them, and make sure that it meets all of their needs, including the progressive nature of dementia.
Thank you. I have one more question for all of you before we open it up to the room if anyone has questions for our panelists. I want to talk about solutions, and specifically in the tech world. You know, we see that AI is everywhere right now, also coming into the caregiving space. Does anyone want to talk about something that they're excited about, any solutions they're excited about coming into the care world that you think is going to have a big impact?
I'm just going to share that because I work with a lot of people with dementia, that sometimes the VA has a really strong progressive look at how can we look at the whole picture and how can we keep people at their least restrictive environment, emotionally, chemically, as well as physically. And so they've been playing with a couple different programs that I don't know if they're going to continue with the funding or not, but understanding that caregivers are and AI cannot replace the connectivity of a caregiver to their care recipient. AI cannot replace the connectivity of a nurse navigator who could potentially give that caregiver what they need at that point of care, point of service need, so that they can keep their loved one home a little longer and can keep them out of unnecessary hospital visits. So I'm excited about some of the things that are coming down the pike, but I'm afraid that people will see this as an opportunity to replace the human side of caregiving and connectivity, which is really what keeps the dignity, which keeps the emotional positivity, which keeps the strength of that person going. So
I'll jump in. I think that we are seeing tremendous growth in this space. And as you said, there's a lot of opportunity for caregivers to get more supports, for paid caregivers to have supports in doing their roles. But I would be remiss if I didn't talk about the need that as technology keeps moving forward, particularly with AI, that from a consumer advocacy perspective, that we have to make sure that it is truly going to benefit that consumer and that it will protect that caregiver and the person that they're caring for. And part of that comes with ensuring that family caregivers, care recipients are educated on how to utilize these technologies. We see so many individuals that are asked to use different medical devices, and they're not trained in how to utilize those things. As we look at AI, we want to make sure that we're protecting individuals from uploading personal information to get more resources or to better understand what they're dealing with because they're not getting it from healthcare providers. So we just have to be responsible in terms of that, and we have to make sure that we're educating family caregivers and others alike.
Thank you very much. Well, we have just a few minutes here. If anyone from the audience has a question, I don't know if we have anyone with a mic floating around or if you just want to, oh, awesome, great. So just give us a wave if you have a question.
My name is and I looked after thank you. My name is Melanie, and I looked after my parents for a collective 19 years, quadriplegia and ventilator dependence, and progressive supranuclear palsy through both of their deaths recently this past January. So I have 1,000 things to say about caregiving. One of them I want to ask is for the people who want to help, private corporations, nonprofits, like how do you move from fee for service to taking care of a family ecosystem, taking care of a whole patient? When my dad came home, he was discharged as a quadriplegic and a 3-ring binder, and they're like, good luck. And, the home health agencies came home and, they didn't want to deal with G-tubes and transfers. They want to just come home, draw blood and leave. So we couldn't keep anyone at home. So, I'm an attorney and I have a master's in policy. I had to quit everything, right? So how do we get away from just fee for service and move toward a whole holistic paradigm of caregiving? In other countries, you have extended families, you have joint families who have, 80% less cost in caregiving. How do we actually do this so that the end user and the end user and their families can be lifted up and have a more sane way of living and getting through these situations? Thank you.
This is an uneducated answer to that. I want to prep that because we've got better experts in the room. But my answer is data. We have to figure out how to connect the data of the cost centers of what the caregivers are doing. When I keep my parents at home and run my butt off every single night after work 2.5 hours, how much money did I save that system? What is the value of me? What was the value of Rick? What is the value of our sibling group? What is the value of our care of our special needs child, grandchild? If we cannot connect that data to cost centers, we will not get the system to move. So being better at placing value and collecting that data on value is so imperative. Uneducated, I'm sure there's better answers.
And I would just add a couple of things. I mean, I think that, and yes, to everything you said, but I also think there has to be an intentional effort here. I think that there's a lot of acknowledgement, but moving that acknowledgement to being programmatic and making sure that our policies are reflective of that is really where this goes. I think about hospital at home. There are a number of great hospital at home programs. They've come a long way. Initially, hospital at home programs did not really focus on that family caregiver. And so what we've seen through some of our work at AARP and just the passage of time and recognition of that role of family caregivers is really the importance of ensuring that individual is supported in the home. And we're seeing, to your point, we're seeing more and more care being driven into the home and on the backs or in the arms of those family caregivers. And it really is connecting the data, but making intentional effort at the policy and programmatic level to center that family caregiver.
I'll make my response really brief and just want to echo the great responses thus far. When I hear your question, I go to managed care. And I'm not sure if that's the direction you're heading in, but we've done this managed care now for healthcare. And we're starting to see states move towards managed long-term care. And with all of this movement for cost savings, I always ask cost savings to whom? We're saving the healthcare system by moving people out of the hospital and into home, palliative care at home, primary care at home. Who facilitates that care at home? It's family caregivers, and we are saving the system money. And so when I think about managed care in the long-term care and caregiving world, I would love to share data showing that there is cost savings. There's a huge return on investment when you think about managed care. And the report talks about Medicare billing codes for providers to be able to charge when they do train family caregivers, when they identify family caregivers as part of the care team. Wouldn't it be great if we could show that there is return on investment when you use those codes and you train caregivers appropriately so that you can facilitate that lower cost care in the home?
Okay, one more question. Yeah.
So we're talking about caregiving and providing care to others, but as you've described your individual situations, I'm curious to know what you have taken away from this as a caregiver. Instead of giving the care, have you been able to receive an inward introspection in how you care for yourself? How has your individual experience changed how you view your individual health? Because I personally believe the increase in number of caregivers is because just as you mentioned, once you become a caregiver, you do it again and again and again. And that means we're depleting ourselves again and again and again. So how has your experience changed your introspection for your own personal health?
I'd like to say I'm taking better care of myself, but I'm not. No, just kidding.
I heard this great analogy that you might have heard before when you're on an airplane and they tell you if the if the cabin drops that you should take care of yourself and put your mask on before helping others around you. And that is absolutely true for family caregiving. I will also say just being aware that we are caregivers is so important just to say it out loud. That report also talked about how 70% of working age caregivers say that they work at the same time, but only about half of them say that their supervisors know it. And is it because we're not asking, or are they scared to say that they're caregivers for fear of ramifications to their careers? So if we name it and we say it out loud, like in my professional spaces, it's much more acceptable to say that you have to leave work early to go pick up a child or care for a sick child. Why aren't we saying the same for older adults who need our care, and for aging parents? So making places inclusive of caregiving culture is not only going to help us for caregiving equity, but also maybe we'll solve the ageism problem too. So to answer your question, I think self-care is so important. Putting that mask on yourself before caring for others, and just recognizing that there are so many of us who are caregivers and we have to name it so the system knows that we're here and we're providing care.
Thank you so much. That was a great note to end this panel on. Thank you so much, everyone up here and everyone out here as well. I know that there are some more questions floating around, so I think that we'll all be sticking around a little bit if anyone wants to come up and ask your questions in person. But thank you. Enjoy the summit. I'll see you all around later today.
Please take your seats. Please take your seats. Please take your seats. We're about to welcome our next speaker. Hello, everyone. We're going to go for our next speaker to come on the stage. So if everyone could please sit their seats. That would be amazing. Once again, our next speaker is about to come on the stage. So we'll take our seats. That would be great. Everyone. Stage. So actually, everyone take another seat for our next speaker who's coming on the stage. Thank you so much.
Please welcome to the stage Dr. Phelan Lewis, family caregiver and assistant dean of student affairs at Vanderbilt University.
Ooh, I like the music. I've never had intro music before. That's so nice. Okay, I've got an eye on my time and I got my clicker. I can't even that because I'm petite. Good morning, everyone. My name is Dr. Phelan Lewis, and I first want to say how honored and grateful I am to Jason, to Lauren, to the entire NAC team for having me. But I stand before you not just as a researcher and an advocate, but also as someone with lived experience as a youth caregiver. So leave the clicker, point it that way. Which way should I point the clicker? Okay. Look at that. There we go. Okay. All right. So when I was 11 years old, my mother, who was generally a pretty healthy woman, she was running marathons in Alaska, was working as a labor and delivery nurse. She was diagnosed with degenerative disc disease. And she had what was considered to be a routine surgery for that condition. But unfortunately, when she woke up from that surgery, she discovered that the surgery was completely botched. The surgeon took out bones from her spine that he should not have and did not put in any plates or screws that would have been helpful. Our lives changed in an instant. I have an older brother. He is 7 years older than me. He came home that weekend just thinking he'd be there for that weekend for my mother's surgery. But because the surgery was botched, he ended up staying home indefinitely. He dropped out of college. He got a full-time job at FedEx lifting boxes so he could pay for our mortgage and all of our household bills. He became what we know as a young adult caregiver. And then I, myself, at age 11, became what we know as a youth caregiver. For me, that meant that I helped my mother with intimate care, so showering, bathing, helping her get dressed, giving her her medicine, so recognizing very long, complex drug names so I could make sure I gave her the right pill that day. I also supported her with wound care. She had a number of attempted corrective surgeries, but to no avail. So our caregiving story started at a very, very young age. I thought I was the only one. I did not know of anyone else who had an experience like myself or like my brother. That continued for many, many years, and I'm so grateful there to my brother. And I would not be standing here in front of you if it was not for the sacrifices that he made to be a caregiver for our family. So shout out to all the other male caregivers here in the room. Yes. But I knew that I wanted to go on to do my part to change the world for other youth caregivers. So about a decade-ish ago, I moved to the United Kingdom, to England, where they're about 30 years ahead of us in this field of policy and practice and research. So I studied under the world-renowned expert in the field, Professor Saul Becker. He coined the term young carers back in 1987 when I was born, and was able to follow his work and learn from the social and healthcare models that have been used abroad. But what has been incredibly privileged about my experience has been to hear the direct voices of children and also to speak with their families. Save that clip. Here we go. The other thing I want to shout into the room is I'm telling you about my story and the stories of other youth caregivers, but I think it's also important that we recognize the disabled person. So pictured there is my mother. She calls herself a fly diva. Yes, yes. And I show that because many of the things and stories that you'll hear in the stats and figures about youth caregivers are quite grim, to be honest. However, with the disabled person, it's important that we remember their full dignity, the joy of who they are, the humanity. And that's why I always like to take a moment so that we recognize that as well, because disabled people are also a part of our story. So as I was saying, as I'm privileged to go in the world to speak with children, adolescents, and young adults who are caregivers, what they often talk to me about reflects very much my own experience. They talk to me about their mental health experience, the anxiety, the depression, the sheer exhaustion they have, the concern that they have about being labeled the problem child in school because they're the child who has to pull out their cell phone so they can check and see what's going on at home. Or they're the child that's falling asleep in class because they stayed up late at night taking care of their family member. What distresses me the most as a former mental health practitioner is when they would disclose about even self-harming ideations and thoughts of harm to the care recipient. And I always bring that up not to sensationalize this, right? We don't want to see this on the headlines of the New York Post tomorrow. But I say that because I truly do believe there's a public health crisis facing our country involving the children and adolescents with family caregiving roles. I can tell you from the research that we've had, we worked with over 10,000 adolescents. About 56% of them said that they had thoughts of harming themselves because they were so stressed with their caregiving role. When I've shared that stat with other practitioners, I have heard, oh, well, young people, they would not hurt themselves, right? Caregivers, they care about the person that they're with. And I think that is the wrong answer, right? That should alarm and frighten all of us here in this room and those listening today. There is an absolute charge that we have to make sure that we are supporting young people with caregiving responsibilities. When you ask children directly what they say that they want, I often hear three things. The first is that they want someone trusted they can talk to, especially as they enter into their teenage years and start to think about the navigation of, can I go to college? Can I be able to marry and date and have all the things that I think a young adult should be able to do? Can I do that? Will my younger siblings be the ones now to have to caregive if I go away? They need someone that's trauma-informed, that's competent, that understands the nuances of young caregiving, to be able to be that guide for them. That's what they say they want. The number two, I always hear that they want recognition. Young people understand the contributions that they're making to their families. And indeed, as our panel said before, really they're undergirding the broken health and social care system in our country and saving our country billions of dollars in care. And that's being performed by children. And the number three, what I also hear is they want money and direct aid to the care recipient. We often hear the rising tide lifts all boats. Well, when you ask children what they want, they say, well, if my person that I care for has what they need, well, that lessens the load all across. So we have to make sure that we're supporting the disabled person because then that also helps me. In closing, I want to read to you a letter that a colleague tasked me with writing. It's a letter of inspiration to myself as a youth caregiver. Dear 11-year-old Phelan, I know nothing makes sense to you. You can tell that something is wrong by the way the nurses whisper outside the hospital room and the curt answers they give your mother while in the room. You wonder, what is going on? Your mother seems so small in the bed. Through her drugged post-operation stupor, you can tell she is trying to connect the dots. All is not as it should be. You feel your stomach start to tie itself in knots. Will anyone explain the situation to you? No one does. Someone should have talked to you. A child life specialist should have come and taken you to the hospital cafeteria, given you an ice cream, and told you what happened to your mother. A nurse should have asked your mother, who resides at home with you besides your 11-year-old child? If asked, your mother would have said, no one. A social worker should have been called, but not to risk your way to foster care, to ensure your mother had home health care workers and that you were in mental health counseling. I am so sorry that professionals failed you. Dear 12-year-old Phelan, it is your first day of middle school. Your brother took you to school because your mother is now disabled and can no longer drive. A group of high school boys pushed you in the hallway and stole your glasses. A high school girl teased you for your dorky lunch bag. When you get in the car after school, your brother asks you how your first day went. You lie. It was great. You lie again when you see your mother. There's too much going on at home. This lie, like the bullying, continues for years. Your mother is wearing a back brace her days spent lying in bed. Why bother her? You shrink yourself. Your mother did not stop being your mother just because she needed care. You deserve to have someone fight for you. You should have felt safe in school. You, like the millions of other youth caregivers, were bullied because you were different. There was nothing wrong with you. Your teachers should have checked in with you over and over again. Your guidance counselor should have asked you about your home life. Your school nurse should have asked how you were really doing. They knew your mother was disabled. They should have helped you. You shouldn't have felt alone. It wasn't your fault. Dear 19-year-old Phelan, you were a junior in college. Your mother's in the hospital. Your mind should be on writing essays for class, but instead you are worried that your mother might die. After class, you go to your mother's hospital room and sleep on a cot at her bedside. You think you should tell a friend. Isn't that what everyone always says? Open up and share? You tell your friend about your mother. Your friend is overwhelmed and does not know what to say. Never mind, you think. You'll never make that mistake again. You ask your therapist for books about young caregivers like you and your brother. He does not know of any. You feel very alone. Like many other young adults in college, you are balancing academics with caregiving without support. You should have been identified as a caregiver when you entered college in the same way that England does for its university students on its common application form. Mental health practitioners should have known about youth caregivers and their unique needs. You should have been told that there are at least 5.4 million children and at least 10 million young adult caregivers in the United States. You weren't alone. You just didn't know it. Every time an adult failed you, you used it for good. You consider your life's work in research and advocacy to make sure other young caregivers never feel like you and your brother. I am so proud of you. I hope for those youth caregivers and those who are younger listening that that is an encouragement to you. But I also hope for those of you who are in the room who are practitioners, professionals, advocates, researchers, that that is a charge. We have much work to do. Thank you.